Hi, today I will be discussing a referral involving a 68-year-old male who presented for exercise physiology services seeking programming and guidance on initiating a high-intensity exercise program with the goal of improving muscle strength and cardiorespiratory fitness. John's primary risk factors include poorly managed stage 3 hypertension, class 2 obesity, as well as elevated total and LDL cholesterol. Secondary to these, he has a history of depression. However, currently John displays a motivated and positive attitude to training with the support of his family. He currently cycles to work 5 days per week and completes 2 gym sessions, is a non-smoker, and does not drink alcohol. His VO2 max and heart rate max are above average for his age bracket, and his LVEF and blood sugar is normal. John's current medication has little effect on exercise capacity, and he has no musculoskeletal issues. The primary goal of this program is to improve muscle strength and cardiorespiratory fitness through combined dynamic resistance and aerobic training sessions. This method has been proven to be most effective in reducing hypertension and associated comorbidities. The main physiological targets of the program are blood pressure, cholesterol control, weight management, and improved mental health. Long term, there is an expected decline in cardiorespiratory fitness with aging. Therefore, John's program is heavily aimed at slowing cardiorespiratory and musculoskeletal decline. In order to assist in monitoring the effectiveness of the programming, John will be asked to keep a diary of his completed sessions. We will also implement the Satisfaction with Life scale to manage John's mental health long term and monitor for any developments of depression. John's program will be a combination of resistance training 2 days per week, as well as steady state and HIIT cycling to be completed during his rides to work. The HIIT sessions will be modified through each phase, with each phase running for 12 weeks. Although John has a reasonable level of fitness due to his current activity level, we will start the sessions at a moderate intensity for the resistance component and HIIT cycling. The intermediate stage will aim to increase both intensity and volume of sessions, in order to build strength for the advanced phase where intensity will be the main target. At the advanced stage point, we will be aiming for improvements on all previously mentioned markers. This has been shown in a number of studies relating to hypertension and combined aerobic and resistance programs completed using HIIT methods. We will discuss each phase in detail shortly. As John was hesitant to increase the intensity of his program, we will manage his fatigue and recovery by completing the bike HIIT sessions on days off from resistance training. Education on breathing will also be an important part of John starting his program, as he needs to avoid compressive breaths such as Valsalva breathing. The possible effects of John's medication and contraindications for exercise will also be discussed to avoid any possible issues during his resistance and HIIT sessions. We will also encourage regular review with a cardiologist and GP to monitor for progress of CVD. Further testing, such as a timed up and go or 30-second sit to stand test, could inform programming decisions initially. However, long-term programming decisions will be made based on monitoring progress in the current phase, as well as exercise proficiency. Other considerations to make in regard to the program would be musculoskeletal range of motion testing. Client monitoring would be done through regular GP checkups, as well as a program diary to increase adherence. The start of the initial phase will include 2 times supervised resistance sessions per week, starting at 50 to 60% of 1 RM, or an RPE of 5, on the 1 to 10 scale. Volume will be kept high with low loads and a major focus on exercise execution. Whole body stretching will be completed throughout all phases prior to starting core exercises. During stretching, John will be encouraged to practice steady breathing, which will help to avoid Valsalva breathing as intensity increases. Core exercises throughout each phase are part of the warm-up portion prior to completing the A1 to A5 exercise circuit at 50 to 60% of 1 RM, or an RPE of 5 on a scale of 1 to 10. Followed by a cycling cooldown and stretching. John's commute to work will continue 5 days per week, with the inclusion of 2 times HIIT-style cycle sessions. Each HIIT cycle session will start with a steady 5-minute warm-up, then progress to 4 times 4-minute work, 4-minute rest ratio at 70% of VO2 max or an RPE of 13 on the 6 to 20 scale, with a 5-minute cool down. John will be encouraged to incrementally increase the intensity of both the aerobic and HIIT sessions over the 12-week period to no more than 75% VO2 max. It is recommended for John to complete daily stretching and 2 core exercises prior to cycling in the morning as a warm-up if possible on some days. This will also help him to manage his posture as his work is primarily seated. At the end of the initial phase, we are aiming to increase the volume in each session with the warm-up and cool-down remaining the same. Sets were decreased to 2 for core work to decrease fatigue going into the A1 to A5 circuit, where we will be increasing from 2 to 3 rounds to be completed at a slightly higher intensity of 60% of 1 RM or RPE of 6. Exercises remain relatively the same with the introduction of a single leg glute bridge and barbell Romanian deadlift, which will allow us to increase loads more effectively in future phases, as well as building up to more complex movements. John was encouraged to continue 2 times HIIT cycle sessions and steady state with intensity closer to 75% of VO2 max or RPE of 14 in preparation for the intermediate phase. With the beginning of the intermediate phase, we will be increasing the complexity of the exercises by adding in reverse abdominal curls, 45-degree back extensions, bent over barbell rows, and bent over dumbbell rear delt flies. The aim of this phase is to increase the intensity of the sessions by increasing 65% to 65% of 1 RM or between 6 to 7 RPE. We will also be decreasing the rest periods to 30 seconds. Cool-down cycling and stretching will remain the same. John's daily commute to work will continue, and HIIT cycle sessions will increase to 3 times per week at 75% of VO2 max or RPE of 14 for 4 rounds of 4 minutes work, 3 minutes rest. Moderate intensity cycling is to be completed as part of this phase. We're not completing HIIT sessions. The end of the intermediate phase will be heavily focused on increasing intensity in preparation for the advanced phase, where volume will be decreased and intensity increased. Therefore, it is important to make sure that John is able to handle this raise in intensity safely. The RDL was modified to a snatch grip to increase demands of the posterior chain, as well as the addition of lunges. Intensity was increased to 70% of 1 RM or RPE 7. The cool-down period was extended to 8 minutes to allow for extra time to make sure John was responding well to increased loads and intensity. The HIIT cycle sessions will remain at 3 times per week at 75% to 80% of VO2 max or an RPE of 14 to 15 for 4 rounds of 4 minutes work, 2.5 minutes rest ratio. The advanced phase will start with an increase in intensity and load and a decrease in volume to allow John some time to adapt to the vigorous intensity we are aiming for towards the end of this phase. Volume has been decreased by reducing 1 set from both the core and circuit part of the program with an increase in intensity to 75% of 1 RM or an RPE of 7 to 8 on all exercises which are part of the A1 to A5 circuit. Rest time has also been increased to allow extra time to monitor blood pressure response between exercises. Side plank pulses have been added to the core portion of the session and front foot elevated lunges to the circuit. Daily commuting will continue with HIIT cycling sessions having the option of 3 to 4 sessions per week at 80% of VO2 max or an RPE of 15 for 4 rounds of 4 minutes work, 2 minutes rest ratio. At this point, as load and intensity is increasing, special consideration needs to be paid to rest and recovery. The end of the advanced phase will see a decrease in the amount of work completed, but increase in the intensity by switching to a circuit with short rests. This is followed by 2 exercise circuits, B1 to B3 and C1 to C3. Conventional deadlifts and standing dumbbell presses will be added in as a main compound lift to this program, with an increase to 3 sets for the B1 to B3 circuit. Rest time has also been decreased to increase the intensity during the end of this phase. Long term, we will encourage John to continue cycling with 4 times HIIT cycling sessions per week at 80% VO2 max or an RPE of 15 for 4 rounds of 4 minutes with 2 minutes rest. Daily stretching is to be completed and core work on all days when cycling. In relation to the unexpected situations during the intervention, to resolve the situation of John's blood pressure spikes during exercise, we decided to be more conservative with progression of intensity and loads. We also provided John with education on negative symptoms to be mindful of when exercising. As John responds well to HIIT style exercise, we incorporated this throughout his supervised and home HIIT cycle sessions. Due to John's medication increase halfway through the intervention, we became more considerate of exercise response during and post sessions. Therefore, we increased the rest times in order to be able to monitor his response, as well as an increase in cool down time to make sure he is safe when leaving his sessions. Vasovagal episodes can occur with hypertension, and in this case, we were lucky that John was not injured and provided him with education on how to avoid this occurring again. Thank you for listening today, and if you have any questions, please feel free to ask.